Hello, my name's Samantha Pugh. I'm a dentist at the Dental Centre Bedford with a special interest in dental implants and dental surgery. I've qualified at King's College, University London, and I've been practicing for 27 years, 18 of which I've been placing dental implants after I gained a Master's in Implant Dentistry at the Eastern Dental Hospital. I think implants are a very rewarding side of dentistry. I've always been passionate about surgery, and so it was a way of me continuing that training in general practice. But implants are really rewarding for patients because they get to have their smile back with teeth that feel and look like natural teeth. And we see immediate improvement in their confidence when we can provide patients with that. But also for me, implant dentistry is rewarding because it's very cutting edge. And here at the Dental Centre Bedford, we're using the most advanced techniques that are around currently. And we're also working with some of the best implant companies in the world so that we can provide patients with the best outcome. For some patients, it can be very routine dentistry, no different for the patient than having a small tooth extracted. As long as you've got a good quality bone, good quality gum tissue, and a nice site. But for other patients that have quite thin bone or who are medically compromised, the treatment can be a little bit more complex. You would probably need about 4 or 5 appointments from start to finish, and the process will take about 12 weeks from start to finish. So we would start with a planning visit at which we would take a cone beam CT, which looks at your bone in 3 dimensions, and from that we can then plan the size of the implant. After that, we can go ahead, as long as you agree, placing the implant, which is an appointment of about 90 minutes. We would then see you to take any stitches out 1 to 2 weeks later. Then we need to wait approximately 8 weeks for the implant to integrate into your body. And at the end of the 8 weeks, we can start restoring the implant with a tooth on top, which takes about 2 to 3 weeks. So it's about 12 weeks from start. No, we can always give you something temporary to fill the gap if you prefer, especially around the front section so that we can put your smile back to where it should be. So there are lots of different options for that. You could have a small removable denture or a fixed bridge. So we can always give you something to fill the gap if you would like. Actually, implants can last anything from 10 years to 40 years in patients, but the research shows that approximately 96% of implants placed will last 10 years. But what we see in patients is that they often last longer than that. But implants aren't without maintenance. So in an average mouth with good cleaning, an implant may last 15 to 20 years without needing any maintenance. You'll also find at the other end of the spectrum patients that are very heavy on their teeth due to grinding, clenching, maybe not so good at cleaning. Implants will probably last less time in those patients and eventually will need some maintenance, either repair of the implant or repair of the surrounding tissues. We definitely advise that you come back at least every year to have the implant and the surrounding tissues checked, so we can look at the bone levels to check that they're nice and healthy. We can look at your ability to clean the implant and help you with that if you need, and also to look at the health of the implant components that are taking the stress from your chewing and eating. I would say there are over 500 different implant companies around in the world at the moment. And in the 18 years that I've been placing implants, what I can tell you is that some implant companies go bust, and then it can be very difficult to get components for that company. So we use here one of the top 5 implant companies that have been around for over 40 years and will always be able to provide components for any maintenance that you might need in the future. Well, if you contact us at the practice, we're currently offering a free consultation, so we could advise if you're a good candidate for an implant. And after that consultation, we would bring you in for a full assessment of the space. So we could do the CT scan that we talked about and the assessment of all the tissues to enable us to decide which implant is the best for you. And we'll go through all the options available and explain to you how it's going to work, and we can move forward from there.